Hello and welcome to Mediclinic Cape Gate. COVID-19 has changed many things in our lives, and while we would love to show you our facility in person in preparation of the birth of your baby, this is not possible at this time. And we hope that this short virtual tour will assist you to be prepared for the admission process to the arrival and stay in the ward, right up to the point of your discharge. With this guide, you will receive a Mediclinic baby handy checklist, which will help you prepare for your hospital stay. But for now, let's start our virtual journey. Your chosen doctor would have explained the booking process for the hospital with you.
This is the main entrance to our hospital. Your partner can park in our car park, and then you can both proceed through the main entrance. Please remember to both wear your cloth face covering at all times. As you enter, the first stop will be the access control point. At the access control area, you will be taken through a quick screening process where you will be asked questions related to your exposure of the COVID-19 virus. You will need to hand sanitize and have your temperature taken. Once you have passed through the access control area, you will be directed to the admissions desk. At this point, our friendly staff will obtain your personal information, such as your home address, your next of kin details, and contact details. You will also be asked to provide your funder details, identity, and medical aid documents. If you will be paying privately, an upfront fee will be required before you can continue with your admission. Once all these documents have been submitted, you will be provided with admission pack, which will detail the ward and room you are being admitted into. We will try and accommodate the room of your choice. However, during the pandemic, this may not always be possible, as patients are strategically placed. You will either be escorted or directed to the obstetric ward. There is clear directional signage throughout the hospital as you make your way around our facility. This is the entrance to our obstetric unit. When you arrive at the obstetric ward, you will pass through security control, which may be a manned door, or alternatively, please ring the intercom bell at the door, and you will be allowed access. Please remember to hand sanitize at the doorway prior to entering. Depending on the time of day or night that you arrive, you will be received by the unit administration assistant or a nursing staff member after hours. They will show you to your room and orientate you to the ward. This is an example of one of the obstetric rooms, which are either private, semi-private, or general wards. All beds have a television screen where you will be able to access a variety of DSTV channels. You can flip through channels using the call bed remote, which is conveniently located. With the call bed remote, you can call for the nurse whenever you require their assistance. In the room, you will also find a modern, comfortable bed that you can adjust to your preference. Your bed will be made daily by our friendly staff, ideally every morning when you take your shower or bath. All rooms have access to a bathroom that is frequently cleaned and comes with fresh, clean towels, which are renewed daily or upon request. The lighting around your bed can be adjusted, and all rooms are air conditioned. There is a small storage area for your personal belongings. In each room, there is a crib for your baby, which has space for all your baby goodies, nappies, barrier creams underneath, and is on wheels for easy movement. You will also be provided with your Mediclinic baby bag that contains all the essentials that you will need for you and baby during your hospital stay. Once you have been orientated to the unit, you will be introduced to your care team, the midwife, the attending nurse, the unit manager, and your doctor will be called to inform them that you have arrived in the ward. Now comes your labor and delivery, and where you will finally meet your baby. Depending on the type of delivery, you will now follow one of two pathways. If you're having a normal delivery, the midwife will explain what will happen depending on how far you are in labor, how the baby is coping, and your pain relief options. In early labor, you will be encouraged to walk and may move around and use pain relief aids, for example, a ball. When you are in more advanced labor, you will be moved to a delivery room. This is our delivery room and is set up both for your delivery and also to receive and assist your baby to adapt after birth if necessary. This is a special bed that is made for deliveries and can be adjusted according to the stage of labor. In each delivery room, there is a special crib for your baby called a resuscitation crib. At the bedside and by the crib, there is oxygen and suction for you and your baby if needed. If your baby is well at birth, the doctor or midwife will place them on your chest. The midwife will assist you with skin-to-skin and breastfeeding. Occasionally, a baby is born and may require some assistance to start breathing. The baby will then be taken immediately to the resuscitation crib and assisted by the staff. This can be very frightening for you as parents, but the staff will inform you what they are doing, and as soon as baby is strong enough, they will place your baby skin to skin. Before leaving the delivery room, your baby will be examined and dressed and warmly wrapped. We recommend rooming in, which means your baby stays with you at all times. If you're having a booked cesarean section, you will be prepared for theatre in your room. This will include getting dressed in theatre clothes. You will then be fetched for theatre in your bed by a porter and taken to the theatre complex. This is the entrance to our theatre complex. There is a waiting area just inside the theatre, and your doctor or anesthetist will come and fetch you when they are ready and take you into the actual theatre. The theatre will look quite busy and has lots of machines, a special theatre bed, spotlights, and the baby resuscitation crib. There will be a lot of activity initially, and they will guide you through this on the day. Once the baby is born, the pediatrician or midwife will assess the baby and intervene if necessary. Sometimes you will be able to hold your baby in theatre, and sometimes your partner will hold the baby while they complete the operation. Once they have you draped in theatre, it is only a few minutes before your baby will be born, but it takes another 20 to 25 minutes to complete the operation. On completion of the operation, you will be taken to the recovery room where they will ensure that your pain is controlled, there is no bleeding, and your vital signs are stable. You will then be taken back to your room, where you and your partner will be able to spend time with your baby. This is also where skin-to-skin and breastfeeding will be initiated. The baby will be comfortably placed in the bedside crib next to your bed, as we encourage that mommy spends time with baby. Our hospital offers healthy, tasty, and freshly prepared meals daily for mommy. Please inquire about meals for your partner when you arrive. During your hospital stay, you and your partner will receive a complimentary celebratory surprise to celebrate the birth of your bundle of joy. This is our baby nursery. Our nursery is kept at a warm and comfortable temperature. The nursery has an area where baby can be bathed. Baby can be closely monitored and observed if necessary, and is a place where any required tests are done. Sometimes a baby requires close monitoring or warming. Then an incubator is used, which looks like this. An incubator allows the baby to be closely observed, and the temperature can be controlled. The nursery is also where we will teach you how to bath your baby using the items in your baby bag. Or if this is not your first baby, you will be able to bath them when you desire. There is a scale and a measuring board for weighing and measuring the baby.
This is our neonatal critical care unit. Here is where babies are cared for that require specialized care. Sometimes you will know prior to the birth that your baby will need to be admitted to a NCCU. They may have a congenital abnormality or may be born too early, and occasionally a term baby may require NCCU care.
The neonatal unit can initially be overwhelming with lots of equipment, noises, beeps, and tubes. The pediatrician and neonatal nurses will keep you informed of your baby's progress and guide you through the neonatal journey. It is important to remember that everyone is working together to get your baby healthy and home with you as soon as possible. Sometimes mommy will be discharged before the baby, and all your options will be explained at the time with regards to visiting and feeding. Due to the COVID pandemic, many activities that would have taken place in hospital have been postponed or now are done as an outpatient. Babies' first vaccinations will still be done in hospital. Newborn hearing tests are done routinely and detect for early hearing loss. If this is not done before discharge, you will receive a referral for the test. The Department of Home Affairs are offering a limited service currently, and all the paperwork for the proof of birth to enable you to register your baby will be explained and handed to you. Please check at the time of admission what the current process is, as this may change at any stage. We wish to assure you that we adhere to the World Health Organization and the National Institute for Communicable Diseases regulations on COVID-19 precautionary measures. We request that you wear a cloth face covering at all times, and especially in communal areas. There are adequate hand wash basins and hand sanitizer throughout the hospital, and we encourage you to use them frequently. We also ask that you stay at your bedside and do not move around. Our staff are all wearing appropriate PPE. This means they will have masks and visors on. Sometimes it may be hard to hear them, and please do not feel afraid to ask questions or for clarity at any stage. Prior to your planned delivery or at admission, mommy will be required to take a COVID-19 test. This will be explained by your doctor during your antenatal visits. The test is required so we know your status and can be aware of any complications from COVID-19, and also that we can manage placement of patients in the ward. Mediclinic does not require your partner to be tested for COVID-19. However, please check with your doctor if they require it. Regardless of test result, you and your partner will still be required to pass through access control. As the pandemic is evolving and there is possible easing of restrictions, please check with the facility for the current guidelines for partner visitation. While you are enjoying your pregnancy journey, we wish to remind you to make use of our Mediclinic baby program, designed to support you through every stage of your pregnancy, birth, and baby care journey. You can access this well-designed program on our website.
We hope you find this tour helpful. Feel free to contact us should you need any additional information. Congratulations on your pregnancy, and we hope to see you soon.